to our prenatal series.
My name's Natasha.
And I'm Melissa.
We are the two AmeriCorps members at the 16th Street Clinic in the Women's Wellness Department.
We help educate first-time moms and provide prenatal care and information to help facilitate a healthy pregnancy for our patients here at the 16th Street Clinic.
Before we begin, if you have any questions or comments throughout the class, please respond to the link that we have in our bio.
It is completely confidential, and we will respond to you as soon as we can.
If anything is urgent or an emergency, please call the clinic as soon as possible. In continuation with our prenatal series, we will be going over some possible options of pain management during your labor. For today's agenda, we will be going over pain during labor, the two available options of pain management during your labor, narcotics and the epidural, and lastly, how to make a decision on what is best for you. Let's begin with talking about why labor is painful. First, the uterus pushes the baby down and stretches the cervix, which is the opening of the uterus. This is what the doctor measures and what they are referring to when he tells you how many centimeters dilated you are. The uterus muscles flex and relax and cause cramping. These flexions of the uterus are called contractions and last 30 to 60 seconds or more during true labor. These contractions are very uncomfortable for the mother and cause a lot of pain. Lastly, during birth, the baby's head descends and crowns. You may feel a burning, cramping sensation during this.
The first option of pain relief are narcotics. Narcotics are a drug that changes your pain sensation by affecting your nervous system, allowing you to relax and lowers your pain levels. They are given through an IV and acts as a fast pain relief. Here is a list of pros and cons on the use of narcotics. The pros include fast pain relief, given through an IV, help you to relax and does not slow down your labor. However, there are cons of this type of pain management as well. The cons include the duration of the narcotics do not last long. It may cause some nausea, may make you feel out of it or sleepy, can make the baby sleep as well, and does not take all of the pain away. They just make you be able to deal with the contractions pains a little better.
The next option of pain management is the epidural. This is a procedure that injects a local anesthetic into the space around the spinal nerves in your lower back. This anesthetic usually blocks the pain from labor contractions and during the birth very effectively. Here's a list for the pros and cons of the epidural. Some pros are that it is very effective and safe. It will not make you feel sleepy or drowsy, numbs your body from the waist down, and helps reduce your pain drastically. Some cons of the epidural include that you lose all feeling in your abdomen and legs, and you are not able to get up and go to the bathroom because of this. You may have a harder time pushing because you are not able to feel the contractions, but the epidural may not take away the pressure. You will feel pressure as the baby's head comes down during birth. It's good to feel pressure because you can focus on the pressure feeling when it's time to push. And it is inserted by a small needle followed by a small tube in your back in which the medication flows through. Lastly, some mothers may not be able to have an epidural due to a variety of medical reasons. Overall, the epidural is a safe and effective way of pain management during labor. However, there are some risks that go along with any procedure. First, some women have leg weakness after, which only lasts a few hours, or they tend to feel a little cold or itchy. Next, some women develop a headache, which can last for 24 to 48 hours after. If this happens, they usually can prescribe some medications to help you. Lastly, very little women have permanent nerve damage. This is very rare and very unlikely.
So, how do you determine what is the best option for you? We recommend you thoroughly research your options and determine what feels right for you. You can start by asking yourself these questions. How strong is my desire to give birth without using pain medications? Will I be happier with my birth after it is over if I go through labor without using medicine? Or will I be happier afterward if I use pain medicines? If my labor is normal and I am in more pain than I expected, do I want my helpers to help me through it, or do I want them to offer me pain medicine? It is completely okay and normal to change your mind before, after, or during the birth of your baby. Overall, it is completely your decision, and your friends and or family should support whatever you choose.
So this wraps up our video on pain management during labor. If you have any questions, please respond to the link we have in the bio. Again, it is confidential and we will respond to you as soon as we can. Please follow the clinic on all social media to keep updated with changes at the clinic. Thank you for watching.